This is Chapter 19, Nursing Care of the Family During the Postpartum Period. Components of nursing care. We want to assist the mother with rest and the recovery after birth, assessment of physiologic and psychologic adaptation, prevention of complications. We want to provide education regarding self-management and infant care, and support of the mother and her partner during the transition to parenthood. In traditional settings, women are moved to postpartum room after recovery. In labor, delivery, recovery, and postpartum settings, women and infant remain together in the room where birth occurs. Sometimes they go to the post-injury recovery room. Regardless of the obstetric setting, no woman should be discharged from recovery until they are completely recovered from anesthesia. This is a view of an electronic record vaginal birth recovery screen. Planning for discharge. Length of stay is dependent upon physical condition of the mother and newborn, mental and emotional status of the mother, the social support she has at home, educational needs of self-management, and financial constraints. This is a view of the screen for postpartum discharge instructions. Mothers and newborns who are at low risk for complications may be discharged from the hospital within 24 to 36 hours after a vaginal birth. This is termed an early postpartum discharge, or shortened hospital stay, or one-day maternal stay. The Mothers and Newborn Healthy Protection Act of 1996 provide a minimum federal standard for health plan coverage for mothers and their newborns. Under the Act, all insurance plans are to allow for mothers and newborns to stay a minimum of 48 hours. Again, as discussed earlier, the Newborn and Mothers Health Protection Act of 1996 allows for a minimum of 48-hour stay. Criteria for discharge was brought about by the American Academy of Pediatrics recommendations. There's an ongoing physical assessment of mom and baby until the day of discharge. Vital signs, head-to-toe assessment, breast, uterine fundus, lochia, perineum, bladder, bowel, and bowel function, and legs of the mother. Lab tests, H&H, clean catch, rubella, and RH on admit. And of course, infant security, prevention of infant abduction. In most hospitals, this is called a code pink. Prevention of infection, we want to teach hand washing, teach how to bathe the infant for first-time parents, breast care and incision care for the mother, educate on checking of the wristband for the mother and the baby, room orientation and how to call for assistance, security precautions for the mother at all times, fundal massage, explain and provide education, the importance of emptying the bladder often to prevent infection and the displacement of the uterus. We want to teach the mother the importance of monitoring pad for excessive bleeding and pad counts, saturation left to right, scant, light, moderate, or heavy, and saturated. Change pads frequently to prevent infection. We want to teach fundal massage, the two most important interventions for preventing excessive bleeding, maintaining good uterine tone, and preventing bladder distension. Uterine atony, this is a relaxed uterus that becomes filled with blood and clots. Perinatal pad saturated in 15 minutes or less of pooling of blood under the buttocks is an indication of excessive blood or loss requiring immediate assessment, intervention, and notification of the primary health care provider. The woman's description of pain and complaints of are the best indicator. The nurse should also assess, palpate cause of pains and discomfort, assess any surgical sites, lacerations for redness, signs and symptoms of redness, infections, discharge, or heat. Patient complaints of pain do not necessarily mean she is not in pain. Patient could be stoic and have sweat on her brow or facial grimacing, meaning she might be in pain. Always promote rest. Postpartum fatigue can cause pain. Promotion of ambulation, reduction of venous thromboembolism, and promotion of exercise. This is a picture depicting exercise that you can teach the woman. We want to promote nutrition, normal bladder function, normal bowel function, breastfeeding, baby-friendly hospital initiatives, and lactation suppression. Prenatal vitamins are often continued until 6 weeks after birth. Encourage a healthy diet. The estimated energy requirements for a lactating woman during the first 6 months is 2,700 calories a day. Higher than normal calories are recommended for women who are underweight or who are breastfeeding more than one infant or exercising vigorously. Let's talk about vaccinations. Rubella vaccination, if a woman is not immune, vaccination is recommended. Varicella vaccination. CDC recommends the administration of varicella vaccination before discharge for postpartum women who have no immunity. A second dose is given in 4 to 8 weeks. Remember, you must get informed consent prior to vaccination. They must practice contraception for 1 month after being vaccinated to avoid pregnancy due to tetragenic effects of the vaccines. Care management, psychosocial needs. We want to discuss the effects of the birth experience, maternal self-image, adaptation of the parenthood, the parent-infant interactions, the mom and dad and the baby, family structure and the functioning and how they're doing, and the impact of cultural diversity. Let's discuss discharge teaching. We want to discuss self-management, signs and symptoms of any complications that mom might have, sexual activity and contraception, prescribed medications, routine mother-baby checkups, and activities of daily living at home. Home visits. Some women are ordered home visits, telephone follow-ups, warm lines, support groups, referral to community resources as needed or ordered. Please review the correct process for teaching a patient Kegel exercises.